সুপ্রিয় দর্শক, আমন্ত্রণ জানাচ্ছি একটি বিশেষ আলোচনা অনুষ্ঠান জিডি অ্যাসিস্ট প্রেজেন্টস মালয়েশিয়া হেলথ কেয়ার এক্সপো 2017-এ। আপনাদের সাথে আছি আমি প্রফেসর ডক্টর ইকবাল হাসান মাহমুদ। দর্শক, কয়েকদিন আগেই অনুষ্ঠিত হয়ে গেল জিডি অ্যাসিস্ট মালয়েশিয়া হেলথ কেয়ার এক্সপো 2017। এই উপলক্ষে মালয়েশিয়ার কেপিজি রাওয়াং স্পেশালিস্ট হসপিটালের রিউমেটোলজি এবং ইন্টারনাল মেডিসিন বিভাগের কনসালটেন্ট ডক্টর আজরিন আহমদ বাংলাদেশে এসেছিলেন। চলুন তার সাথে কথা বলি। ডক্টর আজরিন আহমদ, কেমন আছেন? হাউ আর ইউ?
Thank you very much. Very good.
So welcome to our program.
Thank you.
So first I want to know that tell something about GD Assist presents Malaysia Healthcare Expo 2017.
Bismillahirrahmanirrahim. Assalamualaikum and very good morning. First and foremost, I would like to thank you for inviting me for this talk. I've been here for the GDS Assist Malaysians Healthcare Expo. It's very great pleasure for us to join the program. It's helped us to promote our healthcare system in Malaysia and also to give the alternative for the Bangladesh people for the better treatment.
Better treatment in Malaysia.
In Malaysia, definitely.
How was the feedback?
For the first day, it's really good. We have a good feedback from the audience, especially from the Bangladesh people, and it's a great pleasure to join this expo.
What is your experience about the Bangladeshi people? Their hospitality?
The people in Bangladesh is very good, very good warm hospitality, and we really enjoy to be here.
Okay. Everyone knows about the joint, but I want to know few words from you about the joints. What is joint?
For today, we would like to give a bit brief ideas about joint pain, and particularly joint pain in a woman. Joint basically is a specific structures in our body, particularly in our limbs. It consists of two joint or more, two bone or more bones connected to each other. And joints consist of what we call bone plus the cartilage, which give us a cushions effects and also a protection to the bone. In the joint as well, we have synovial fluid, which acting as a nutrition to give the nutrition to the cartilage and the bone. Apart from that, also joints also consist of ligament and tendon, which bind the bone and give flexibility and movement to the joints.
For healthy joints, it's important.
Yes.
We want to know about unhealthy joints and what are the causes of unhealthy joints.
When we're talking about unhealthy joint, it consists, or we can identify the causes by saying that the unhealthy joint can be due to the inflammations, or what we call is arthritis. It's a response to our body to infections or inflammation. Unhealthy joint also can be due to infections, injury, especially from the accident or the sport injury. The unhealthy joints also can be due to disease that we call gout, and also because of overweight, and also because of aging process, this can lead to osteoarthritis.
দর্শক, ডক্টর আজলিন যেটা বললেন যে জয়েন্টের কথা কিছু বলেছেন, যেটা বাংলা আমরা সন্ধি বলি, তো সেখানে তো সবসময় আমরা হেলদি জয়েন্ট আশা করি, কিন্তু অনেক সময় আনহেলদি জয়েন্ট বা অসুস্থ জয়েন্ট হয়ে যায়। সেগুলো জীবাণু থেকে হতে পারে, আঘাত থেকে হতে পারে, এবং আরও অনেকগুলো কারণ ডক্টর আজলিন বলেছেন এই আনহেলদি জয়েন্টসের, অর্থাৎ অসুস্থ জয়েন্টের, সেগুলোকে যেগুলোকে আর্থ্রাইটিস বলা হয় সেগুলো। সো ডক্টর আজলিন, tell us something about the joint pain. Joint pain means arthritis, or arthritis means joint pain?
Okay, joint pain is the symptoms.
Joint pain is the symptom.
So basically, when the patients complain of joint pains, it consists of definitely is a pain to joint. It's either one joint or multiple joint, and it's also associated with swellings, warmth, and also inability to move. Is a pain when movement, and sometimes patients complain of clicking sounds, especially in the knee, the big joint, when they move. So that's kind of the symptom. When we're talking about joint pain, it's more of the symptoms.
So ডক্টর আজলিন যেটা বললেন সেটা হচ্ছে মানে জয়েন্ট পেইন হচ্ছে আর্থ্রাইটিস হলে একটা তার লক্ষণ হচ্ছে জয়েন্ট পেইন, অর্থাৎ আর্থ্রাইটিস থাকলে, অসুস্থ জয়েন্ট থাকলে সেখানে ব্যথা বেদনা লেগেই থাকবে। সো হোয়াট আর দ্য কজেস অফ আর্থ্রাইটিস? Lots of arthritis are present in our body. It may occur. So cause, if you can just such as rheumatoid arthritis or like this.
Okay. When we're talking about the causes of joint pain or arthritis, we can divide between inflammatory causes or is it non-inflammatory causes. So when we're talking about inflammatory causes, it comes under the categories of rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, or even seronegative arthritis. Then we talk about non-inflammatory arthritis. This come of osteoarthritis, and then arthritis due to like hypermobility syndrome.
Gout, what classification you will?
That's interesting about gout. Gout is more, we're talking about crystal arthropathy, is a metabolic joint pain. So gout in the categories of, sometimes we call it under inflammatory arthritis as well.
That is, gout is in anti-inflammatory classification.
Yes.
Why we know that the women are more vulnerable to get the joint pain or arthritis? Why the women mainly affected by this arthritis?
Okay, it's very interesting when we're talking about women and arthritis. So basically, when we have about more than 30% of women have arthritis in comparison, about less than 20% in a male to develop arthritis. So the main reasons, it could be due of multifactorial as well. One, it could be because of hormonals, but it's not a direct factors associated with arthritis in women. But some experts believe that when the woman reaching menopause, so the estrogen hormone will be less. So it will be related to develop arthritis like osteoarthritis. The other thing is a woman is prone to get the autoimmune disease. So that's come of the risk of to develop rheumatoid arthritis, one of the inflammatory arthritis. The other thing probably because of expert belief that women, they have different body structures in comparison to a male, where they have more broad pelvic bone. So it will give a kind of instability in the posture, which cause more pressure to the joint, especially the lower part, the knee and the ankle. So that's why a female more develop of osteoarthritis compared to the male.
What is the scenario in Malaysia? In Bangladesh, the women sit like just in the sitting position. They develop arthritis more. But what about the Malaysian women?
I think
because lots of work they do.
Okay, I don't think there's so much of difference between Bangladesh women and Malaysian women, because we are still doing lots of housework. But the only thing is, I can see that nowadays there's a trend to develop osteoarthritis in female because of one of the risk factors, because Malaysia is one of the highest obesity in comparison to the Asian population. So this is contribute one of the risk factor to develop the joint pain, especially osteoarthritis in the female.
I saw when I repeatedly visited Malaysia, I saw that the female are working in the toll collection, toll plaza, more than the male person. So they stand for a long time in the toll center.
I believe that in the toll center they are sitting down. Actually.
Oh, they sit.
Yes, yeah,
not standing.
Yeah, but most of the time depend on the occupational as well.
Occupational.
Yes, because if you're talking about osteoarthritis in a male affecting the fingers, so we see more of the occupation involving the small movement of the finger, for example, musician, okay, barbers or the tailor, they're using the fingers. So develop more of osteoarthritis in the fingers.
Dr. Azlin Ahmad, we will take a very short break. GD Assist presents Malaysia Healthcare Expo 2017 আপনাদের সাথে আমরা আলোচনা করছিলাম ডক্টর আজলিন আহমদের সাথে আর্থ্রাইটিস নিয়ে। ডক্টর আজলিন আহমদ, ওয়েলকাম ব্যাক টু আওয়ার প্রোগ্রাম। Any age limit, that is 30, 40, 50, the females suffer more. You told about the menopause, but any difference other than menopause? Only age is the factor. It can happen.
So basically, when a woman have the arthritis, they can have from younger age until the more than menopause. But when we're talking about inflammatory arthritis, it's more common in a younger age group of female. So usually we see arthritis even in the children as well. That's what we call a juvenile arthritis. Women prone to get the arthritis, especially during the childbearing age. So we are talking about teenagers up to age of 45. And after menopause, we are dealing with another type of arthritis. Even elderly also have a risk to develop autoimmune arthritis, for example, rheumatoid arthritis. But we commonly see the group of inflammatory arthritis and this younger group of female.
What are the usual symptoms for this arthritis?
So basically, patient will come with the symptoms of definitely joint pain.
Joint pain.
It's either a small joints or it's either the large joints. So it's usually associated with swelling, warmth, and difficulty in movement. The other symptoms when we're talking about inflammatory arthritis, sometimes patient presented with constitutional symptoms, for example, fever, feeling unwell as well.
In Bangladesh, tuberculosis is very much prone, very common. What about in Malaysia, tubercular arthritis? You get?
It's really common to have a patient with rheumatoid arthritis. We are
tubercular arthritis.
Yes, rheumatoid arthritis. We have lots of types of arthritis basically, but rheumatoid arthritis is one of the commonest that we can see in Malaysia. But we don't have a full data about how many patients, population yet. We are collecting a data.
Okay.
So beside that, we also dealing with arthritis, especially in the younger group in male. So we are seeing a colonzine spondylitis in a male. For elderly, we're seeing more of osteoarthritis.
Dr. Azlin Ahmad, can a woman can be conceived or be pregnant with arthritis or joint pain? Okay. Is it possible?
That's a good question, because when the patients, especially a younger group, they come and see us. One of the common questions they ask, can we get pregnant? So basically, they can get pregnant, but the most important thing they have to understand their disease. Number two, if the disease is well controlled without any major complication, definitely they can get pregnant, but with the advice from the rheumatologist and also the gynecologist as well.
Any risk there?
Definitely there is a risk, but however the risk of pregnancy is similar to the general population. So in terms of miscarriage, abortion, deformities or tetragonic is very minimal risk. But the most important thing, the patient have to understand their disease and the medication. So before the patient get pregnant, usually they need an advice from us. At the same time, we'll try to adjust the medication, which can be safe for the pregnancy and for the baby as well.
Especially you treat the arthritic patient. In Malaysia, in your hospital, any extra system that is what we are not giving in Bangladesh, or did you find any difference between management of arthritic patient?
Basically, the management of arthritis, when we're talking about rheumatoid arthritis, so basically I would say we are following the standard. We are following EULA guideline, is a European guideline, and also American guideline. So if Bangladesh doctors follow this, I will practically say it will much more or less the same. But the only thing that we are more advanced, because we are using a new drug, what we call is a biological DMARDs. This is a drug modifying anti-rheumatic disease drug. That says specifically is more of a high technology drugs for treatment of arthritis. Apart from that, we also provide extensive physiotherapy and occupational therapy for patients who had joint pain, which develop disabilities of deformities. Apart from that as well, we are collaborate with orthopedic for a joint corrections or any joint surgery if needed.
This disease modifying drug, the patient has to take for whole life or for a certain time?
Okay, there's two type of disease modifying drugs. We are talking about conventional and also biological drug. For conventional drug, usually we need to take until the patient develop what we call is a remission. Means that a stable disease. So most of the time they have to take for a lifetime unless they have a complication.
do you suggest the patient for any specific diet, or you advise not to, don't take this diet, don't take, you take this form of diet, or this, you avoid this form of diet?
Okay.
Any role of diet in?
Basically, if you're talking about, there's a different types of arthritis. If you have arthritis because of gout, definitely you have to control your diet. So you have to take low purine diet. For example, you cannot eat too much of meats, internal organs of animal, and also beans. But for the rest of the arthritis, I don't think there's a major diet restriction, unless you are talking about if your patient taking steroid, for example. So definitely you have to reduce your sugar intakes, carbohydrate intakes, because of the complication of the drugs, not because of the disease itself.
Obesity is becoming a global problem. Obesity has any role to develop arthritis?
Yes, one of the risk factors of osteoarthritis is obesity, because you are putting on weight and you're putting a pressure to the joint. So definitely one of the treatment that we ask a patient is to reduce the weight.
Right. প্রিয় দর্শক, ডক্টর আজলিন আহমদ অনেক কথা বলেছেন যে যারা গর্ভবতী মহিলা, তাদের যারা আর্থ্রাইটিসে ভুগছেন, তাদের একজন অবশ্যই রিউমাটোলজিস্টের সঙ্গে এবং গাইনোকোলজিস্টের সঙ্গে কথা বলে নিতে হবে, কারণ কিছু হলেও রিস্ক থাকতে পারে। একটা কথা বলেছেন, অবিসিটি যারা স্থূল, তাদের অবিসিটি অবশ্যই কমাতে হবে, কারণ অবিসিটি হলে এই নি জয়েন্ট কিন্তু অনেক এফেক্ট করে। এবং আরও নতুন নতুন ওষুধ মালয়েশিয়ায় ডক্টর আজলিন আহমদরা প্রয়োগ করছেন। এই ওষুধ খেলে অনেকটা ভালো হবে, কিন্তু তার সাথে সাথে ফিজিওথেরাপির কথা উনি বলেছেন। সো ফিজিওথেরাপি হ্যাজ সাম রোল in the treatment of arthritis.
Yes, definitely it's a major one of the treatment that we give, because beside the pharmacological, when we're talking about drug, physiotherapy and occupational therapy will help the patient not only to ease the pain, but the main concern is just is to give back the flexibility and mobility of the joint.
Thank you very much, Dr. Azlin Ahmad, for coming Bangladesh from long way to Bangladesh. Malaysia is a beautiful country, and we always believe that Malaysia is truly Asia. Thank you very much for coming and telling our viewers about arthritis and a breakthrough which occurring in Malaysia, in hospital, your hospital, you are giving. Once again, thank you very much.
Thank you very much for your invitation. I really enjoyed Bangladesh. My last words before we end up, if the viewer have a joint pain, please come and consult the doctors.
Definitely they will come.
Okay.
প্রিয় দর্শক, এতক্ষণ আমাদের সাথে থাকবার জন্য আপনাদের অনেক অনেক ধন্যবাদ। জিডি অ্যাসিস্ট সম্পর্কে জানতে বা যোগাযোগ করতে কল করুন 01617666888। লগ ইন করুন www.gdassist.com। এছাড়াও ফেসবুক পেজ ভিজিট করতে লগ ইন করুন www.facebook.com/greendeltaassist। প্রিয় দর্শক, আগামী পর্বে জিডি অ্যাসিস্ট প্রেজেন্টস মালয়েশিয়া হেলথ কেয়ার এক্সপো 2017-এ আসা একজন অতিথির সাথে কথা বলবো। আপনারা ভালো থাকুন, সুস্থ থাকুন, নিরাপদে থাকুন। সবার জন্য রইল অনেক অনেক শুভকামনা।